Join us as we explore the ready stance and sway for balance. Hi everybody, welcome to another episode. I'm your host here, Peter Teloniadis, and today we're going to be talking about the ready stance. We're going to have ourselves in a comfortable position, and when you're ready, you're going to close your eyes. Side shifting from the right to the left, we're going to repeat this motion 10 times. And as you sway, have a feel for your center of gravity as it shifts from left to right. What you should notice is your hips should be in line with your shoulders. You shouldn't just be tilting your shoulders left and right, but rather your torso should be relatively vertical compared to your legs. As we go through this side-to-side motion, try to really push your limit and try to focus on reaching as far out as possible, all while not lifting the opposite foot. If your balance is not the best, perhaps what you can do is place a chair in front of you. That way you can ensure that if you lose your balance, you have something to hold on to as a precaution. Let's do 3 more here. And 1, and 2. You're just holding each position for roughly 2 seconds, just acknowledging that you have a stable stance. Okay, good job, that's your 3rd. Now what we're going to be doing is swaying forward and back. So as we sway forward and backwards, you'll notice that I also adjust my hands. As I sway forward, my hands move backwards. As I sway back, my arms sway forward. This way, I can create more counterbalance and allow for a little more of a larger range with my sway. You'll notice that as I'm rocking backwards and forwards, my weight bearing shifts from my heel as I move backwards to my forefoot or the toes as I move forward. And this gradual transition allows for me to get used to rocking back and forth. Okay, let's do 3 more together. 1, 2, 3. Good work, everybody. We're going to side shift again, sway from right to left. So you'll notice that my center of mass is at my navel, my belly button. And when I'm walking, my center of gravity lines up with the inner ankle. So you'll notice here that when my navel is shifting from side to side, it's aligning perfectly with the inner ankle. The medial malleolus, which is a bone located in our inner ankle, is usually the point at which our center of gravity meets when we're walking. And so you'll notice when I'm side shifting from right to left that my navel does not surpass that inner ankle area, the medial malleolus. So as we go into the forward and backward sway, I want to bring to your attention the muscles that we actually use for this movement. As we sway backwards, we are using much of our front of the shin. We're using our hip flexors, which is the hip area, and we're using our abdominal muscles. And as we sway forward, we use a different set of muscles, the muscles of the back of our body, including the calf, which is the back of the shin, the hamstring, which is the back of the thigh, partly our glute, and also our low back. Okay, that completes the forward-backward sway. Next, what we're going to be focusing on is a rotational movement that is encouraging right rotation, encouraging rotation of our trunk, of our hips, of our knees and ankles, and left rotation. As our eyes are closed, we will try to weight shift our body, try to feel the body purely rotating from the torso. Imagine your spine is a skewer and you're trying to rotate it from left to right. We're getting accustomed to this motion as it's quite debilitating to maintain this if you have a vestibular disorder. you'll notice that your ankles do cave in and out. As you rotate to the left, your right arch will collapse, and as you rotate to the right, it will increase, and the opposite goes for the other foot. As you rotate to the right, your left foot collapses, and as you rotate to the left foot arches more greatly. Also make sure that your head and torso are staying in line with each other. Okay, now we're going to be focusing on a side bending motion, where we side bend our body to the right and then side bend your body to the left. You'll notice that my head and torso again stay in good alignment. However, here I'm actually bending from the low back. I slide my hand down the side of my thigh, and you may notice that my pelvis sways in the opposite direction of how I'm side bending. So as I'm side bending towards one side, you'll notice that that same leg will straighten and the other one will slightly bend. This is to accommodate for this slight hinge in the torso that occurs when you're side bending. You'll also notice that when I'm side shifting towards one side, the opposite foot may be slightly lifted. This is normal, as you'll want to make sure that you're comfortably side bending. If you do have any low back pain, you may want to stay away from this one, as it may cause some pain. Let's repeat this a second time. Again, working on our rotation here. You may notice that the movement again is coming from my pelvis, my hips, my knees, and my ankle. And that's an important component to take note, because when you are bending and lifting and twisting, many people who injure their low backs end up doing so because they incorporated a bending and twisting motion from their low back. So if you can get accustomed to rotating and bending using the legs, that would greatly advantage you and greatly reduce the risk of low back injury. Okay, let's complete our last 3 repetitions here. And 1, and 2, and 3. Very good. Awesome work, everybody. You're doing great. It's not easy, especially when your eyes are closed, to really feel all this movement. Side bending to the right and left. We're going to repeat this 10 times. And you'll notice that I rely on my thigh to guide my motion. This is on average how far you should be able to bend relatively to your knee. But if you have slightly less movement or even greater movement, it's okay, as long as there's no pain with this motion and you're not getting any feeling down your legs, pins and needles, or numbness. If you're getting any disequilibrium as a result of this, pause and try to recalibrate your vestibular system until you can resume again. You may want to do it while staring at a fixed object in front of you with your eyes open, obviously, and focusing on that fixed object that may help to still your mind. With your eyes closed, you're not having to rely on your vision, so maybe a little bit more disorienting. But if you get to this level, that'll be good. Okay, next we're going to change foot positioning, and we're going to have ourselves transition from forward and back. So place your foot a stride away, and we're going to get accustomed to weight shifting from our front leg to our rear leg. We're going to be repeating this 10 times. You may notice that as you shift forward, your opposite heel will rise. So in this case, as we shift forward on our left foot, our right heel rises, and as we shift backwards to our right foot, our left forefoot rises. This simulates our normal walking pattern. We would want to repeat this with our eyes closed to increase a degree of challenge to this exercise. And we're going to switch now. So we're going to be repeating the same motion on the left. Now, typically in these motions, we have our stance in a narrowed position, and it's okay if you need to widen your stance, especially if you're losing your balance, but if you can, do try to narrow that stance to make it a little more challenging. So you'll notice that the movement is coming from my pelvis, but not from my shoulders. I'm not swaying my shoulders forward and back, but I'm stacking my shoulders on my hips. So my head, shoulders, and pelvis should really be in perfect alignment to each other. We're going to be repeating this forward back sway once more on each side here. So here we go, completing our 10 repetitions. So you're rocking your torso forward and backwards as you get accustomed to this movement. And it's important to note here that you want to keep your feet parallel to each other. Also, you want to try to keep your pelvis in alignment with that forward position instead of having it side shifted. 8, 9, 10. Okay, now we're going to switch over to our other foot, and we're going to repeat our last 10 on this side. As you get a little bit more confident with this forward and backwards motion, you may want to cross your hands over your chest. So as we finish our last 5 here, 4, 3, 2, 1 more. Awesome, everybody. Okay, now we're going to be working on a diagonal motion. You're going to actually widen your base of support slightly, shifting that front leg hip width apart, but kind of 2 feet ahead. And instead of just keeping your pelvis in alignment with those toes, you're going to face your pelvis forward, and you're going to use this diagonal motion to take a step out. Again, getting accustomed to really getting a nice outreached position with that left foot here, and getting a feel for quite a bit of weight bearing on the right foot. This is really to build your confidence with stepping through motions. So you really want to get practicing this as frequently as possible. Now we're going to be transitioning to the other side now. This is particularly important for individuals who've either had any hip replacements, knee replacements, or any other surgeries, or have reduced their confidence with walking or even standing. And even people who have an increased risk of falls. The fear of falling and the history of falls in the past are the 2 biggest predictors for future falls. So you want to be practicing these kind of motions in order to get accustomed to your body's weight transfer. We're going to shift over to the right side again here. And as we start to finish up and wrap up with this episode, we would like to acknowledge that falls are obviously a very serious concern. So make sure you have a chair again, or a countertop or something to hold on to, especially if your eyes are closed. You may even need to have somebody there to assist you as a precaution, especially if you do have that risk of falling. But otherwise, this is a very good motion and movement pattern to get comfortable with, especially if you've been debilitated through vestibular disorders and have been bedridden for quite a while. It's a great way for you to get accustomed to the weight-bearing motion of standing and walking before you go out for a walk. Okay, everybody, well done with your exercise today. So as we slowly wrap up this episode, just wanted to thank you all for joining me today. And if you liked our episode, make sure you subscribe to our channel to see more relevant videos related to balance awareness. Thank you.